Right.
Okay. Okay, I guess should be good morning, everyone.
Good morning.
Yeah. Thank you very much for actually setting up time to listen to this. We're very excited. We know you have a very busy schedule, but really we appreciate your time to actually listen to this exciting story of Tanzania. I think we'll introduce ourselves. My name is Shahada Kinyaga. I'm the head of the A360 project in Tanzania. With me, I have...
I'm Madeline Moore, our technical advisor for innovation in our sales and marketing team.
And I'm Stacey Barnes. I've been the HCD consultant on this work with the team here in Tanzania.
Yeah, so I think we'll go straight to the presentation, and right in front of you have the agenda that we want to talk to you today. So we really want to talk to you about 4 things. One, we want to clarify some of the terms that we've been using, some of the things that we are using in the process, but we want to give you a quick recap of where we are, how we got here, what we've done, and what we are, testing right now. But then we want to, propose next steps, tell you what are the next steps moving forward. So we thought it might be very helpful to talk you through a few of these things first. Actually telling you the difference between the user-centered design and immersion, but also clarify some of the terms. We understand a lot of people, a lot of experts are involved in this process. They use different terms, and these terms might mean different things and might be confusing. So we want to tell you, when we say certain terms while we are presenting, what we really mean. But we want as well to tell you where Tanzania started, where we are, and how we got here. So just to tell you the difference between UCD and immersion. So an immersion is not the UCD process. It is a tool to be used within the UCD process. An immersion brings together different experts who generate tons of concepts to address different aspects of the ASRH ecological framework. And these concepts usually help to guide the team. So after the immersion, the concept used to guide the team in different ways. The team usually don't take the concepts that are coming out of the immersion and develop them fully, no. But the concepts usually change significantly as the team iterate them and work on them. So you'll see how these the concept have changed in the coming slides. But we wanted to actually emphasize here that usually what come out of the immersion is not what the team take forward. They usually change significantly. So some of the terms that we use, as I said earlier, we understand there are different experts involved, and different terms probably are used differently and might be confusing. So we just want to actually say this up front when we say certain terms, so you understand when we say certain terms as we move forward in the presentation, what do we mean? To start with insights. So really insights is a pattern of behavior that have been identified in the market, and numerous observations. So numerous observations can lead to an insight, and insights exist to actually explain why people behave in a certain way. For example, if girls are not taking up services, why they behave that way? And a lot of people have been asking us, can an insight be good? Can an insight be bad? And we think insights are not good or bad. Insights can be deep or they can be shallow. And the more you interact with an insight, the more depth you gain. And you can only gain even more depth by actually creating something. You create something tangible and take it to the end user. Get feedback from the end user is when you gain more depth in an insight. Again, you see that as we go forward. So other words that we'll be using, another term is concept. So concept is a tangible idea developed by a team during an immersion. So a team of experts coming together develop these concepts. And components, these are specific elements that when they come together, they form a concept, and components are informed by insights. So different concepts are informed by insights, and when they come together, they form what we call a concept. So let me give you an example of when somebody wants to actually do a transportation invasion. An insight can be people want to move from point 1 to point B, but then when you combine different insights, multiple insights, you get to new opportunity, for example. So when you combine multiple insights, like people want to get from point 1 to B faster, people want to get from point 1 to B without hassles, you might lend to a more desirable concept than if you focus on only one insight. You can say, for example, if you focus on an insight that people want to get from point 1 to B faster, you can say a concept might be let them use taxi. But if you combine these insights, you reach to a more desirable concept. So let me walk you through where Tanzania started. So we started with a private donor with a slightly different goals. So we did landscape analysis, user need analysis, and choose the hardest to reach population. And these were girls who are not married, girls who don't have children, and the 15 to 19 years girls. And so the deliverable of the private donor as well was to actually try the immersion as a tool of the human-centered design process and build the internal capacity of the team in Tanzania. So that said, we are very excited to actually integrate the A360 resources. I'm talking of the neuroscience, the anthropology, and the design standard to the process. So we are really excited to integrate these things, use the design standards across the process, and apply all the design standards elements.
Shada?
Yes.
Is it okay to ask just quick clarification question during the presentation?
I think so. Yes, go ahead, Alice. Thank you.
Great. Just quickly, so you said the goal was not the same. Can you explain to us what was the goal of PAMSCOT?
So really, PAMSCOT started PAMSCOT started by a goal where she wanted us to reach the hard-to-reach population. And she wanted us to use immersion as a tool of a human-centered design process. And the other thing, the goal was actually to build the capacity of the team in Tanzania. So there were three. One, reach the hard-to-reach population. So to her, it was the girls who don't have children, girls who are not married, and the 15 to 19 years old girls. So really, this was the focus of PAMSCOT funding. And the other thing was, let us use immersion as a tool of the HCD process. And the other goal was actually building the internal capacity of the team in Tanzania. While using the landscape information, and we also looking at the landscape information and looking at the use need of these girls in Tanzania, there is where PAMSCOT landed, that let us reach these not married, girls who don't have children, and the 14 to 19-year-old.
And I'll just chime in really quick here. This is Stacy. I have been going back through all my emails for multiple reasons. I have an insane amount of the data that she compiled in order to kind of come up with this. So I don't know if it's helpful for the Tanzania team to share that. We've been talking about sharing all of the stuff that got us here. So if you want to see any of that, it's available.
Right, thank you for clarifying.
So a quick recap of where we are. So we are in the iteration loop where we are testing concepts and are now testing different components of different concepts that come out of the immersion, and try to see what concepts are working. So there is where we are. As I said earlier, we're excited to integrate all the A360 resources, the design standards, neuroscience, anthropology. We are very, very excited. So a summary of what we've done so far. So we've engaged 20 design experts. We've engaged 15 technical experts consulted. So we've also engaged like 12 partners and have done rough prototypes. So we have actually created about 12 rough prototypes. We've also done literature review. In my apologies, we missed the numbers there, but I think these are the numbers I'm telling you. We can actually send a revised presentation.
Do you know what?
So we've done literature review. We've done landscape and gender analysis, and we've done 2 research trips and 2 immersion. So those are the people we've engaged. So we have engaged like different experts. On the research, we have actually done research among providers. We've done research among girls. So putting girls at the center and understanding all other stakeholders across the ecological model. So, for example, if the girl is at the center, we understand parents as well, people around the community, boys and all that. So having girls at the center, during the research, we went ahead and talked to boys, we talked to providers, we talked to parents, we talked to different people, different stakeholders across the girls' ecological model. Again, on the provider side, we talk to providers themselves, but then all other stakeholders across the ecological model, providers themselves, parents, girls, and community leaders, religious leaders, to get an understanding of everything around the provider and the people around the provider. So again, after the research, we went ahead and do the immersion. So we did a girls immersion where we're looking at generating ideas, having all these experts in the room, generating concepts specifically for girls and the stakeholders that are influencing girls across that ecological model. And on the provider side, we look at the provider at the center, generate tons of concepts around the provider and all other stakeholders across the ecological model. So on the girls' side, having the girls at the center, the opportunities that we explored during the immersion, where we had several of these opportunities that focused on a girl herself at the center, but then we had other opportunities that we explored that were focusing on other stakeholders and other influencers across the ecological model. The provider, again, at the center, we had opportunity areas that were focusing on exploring concepts around the provider herself or himself and other stakeholders. So we had tons of opportunity areas to explore concepts around the provider and other influences around the ecological model. So around 12 concepts were generated from these 2 immersions, and really why those concepts are still valuable, it's because they are part of the ideation process, but then the team is not implementing the concepts as they came out of the immersion. We are continuing testing. We're continuing with these prototypes by actually testing different components of these concepts to see if, 1, they get girls to take up services, and then 2, if they get more providers to provide services, friendly services to girls. So we had tons of concept around girls, tons of concept around providers. So what we're testing is actually this component to see if we are getting what we want to get out of these concepts. 1, getting girls to go to take up services, and 2, getting providers to provide friendly services to girls. You'll see that as we go ahead, as we go in other slides. So where we are now, we should I go ahead or anyone have a question? Sorry. Or you ask at the end.
I have a small question, but you might unpack it, Shada. I was just looking at the last slide.
Yes.
The one where you're talking about, yeah. So I'm not sure I understand this, and it would be helpful to have an example. So if you're going to do that, that would be great. Otherwise, it would be helpful just to understand, like with a concrete example.
Okay, probably you will see that as I go in other slides. And please, Alice, if I have not responded your question up to the end of the presentation, can you please remind me that question?
Thanks. Great.
Let me share with you a brief overview of the concept we are working at the moment. So we are working on three larger concepts that addresses the girl and who we've come to understand as the most crucial influencers of this girl, the parents and the providers. So to start with the provider, we are testing this concept of youth-friendly SRH certification program to the provider. And the components that are within that concept are using girls to actually select providers, provide on-job skills building to these providers who have been identified by girls. And then the other thing is certifying the best performing providers, and then doing value exploration to inspire more providers who are less positive to girls. Where this concept started, it started during one of the immersion where one of the group tested using girls as medical detailers. So, coaching girls to go and talk to providers, but then providers were not happy to talk to girls. Providers consider themselves as experts. They're like, what are these girls telling us? So we said yes, but there's something that we learned out of this exercise that yes, providers didn't like girls to talk to them, but then girls could identify who a friendly provider is. So we learned by doing this exercise that girls can tell us who a friendly provider is because they know what they want in a provider. They know who is friendly, they know who is not. They know what provider is friendly and what provider is not friendly. So we really we then took that learning and take it a step further by using girls as screeners or using girls as mystery clients to test if they can identify friendly providers, and they could. It really worked very well. They identify a pool of friendly providers, and we then learned that one thing that we learned out of the research, provider research, was that provider can tell us that they are friendly, but then in action, they are not. And we were like figuring out how do we really identify this friendly provider. But then when we try this concept of using girls, it really worked in actually telling us this is a friendly provider because this provider interacts with a girl and, show some of the behaviors to a girl that a girl come to us and say, this is a friendly provider and this is not a friendly provider. So we learned something there that providers can say we are friendly, but in action they are not. But when their definition of friendliness is completely probably different from us, they consider themselves friendly even if they deny services to girls. To them is like, we are protecting these girls. So to actually know if a provider is friendly or not, you cannot tell by just, asking a provider. You need to, create that interaction with a girl. And this was actually a very useful test that we conducted and actually yield very good results to us. So another thing that we really learned out of this was, yes, girls went out and selected providers, but then we are getting very few providers who were saying are positive, and when girls went to them, they were really positive. So we then said, what do we need to do? We need to actually use these positive providers to motivate the less positive providers, and we call them kind of the low-hanging fruits. Those who say we are positive, yes, we are providing services, but in action they are not. So we then thought of actually a certification ceremony, certifying the positive provider publicly in a way that will motivate the less positive provider. And the other thing is using value exploration to actually inspire the less positive provider. So this is actually the next step that we'll be taking this testing to. So the next step of this concept is actually to try those certification and try the value exploration component. So another concept I would like to explain is the parent clinic day. So the parent clinic day concept is the concept where we bring parents together at a clinic to learn about their girls' SRH, and have that commitment that they will refer their girls for services in the next day or next couple of days. And this as well started as a slightly different concept. So it started in one of the immersion as an idea where the team tried to bring together the traditional initiation ceremony leader called a Nyakanga and a provider to talk to girls, and it worked really well. The provider and this traditional initiation ceremony felt really comfortable talking to girls, and they felt what they're saying is acceptable. Girls and parents were like, yes, we are comfortable for the girl to be taught by the Nyakanga and the provider together, because the Nyakanga is a trusted woman in the community. But we know that in Tanzania, girls, there are very limited places where girls learn about ASRH, and these places are either in school or at these traditional ceremonies called Ngoma. So we then said, what can we do actually to make sure that everyone, like all the girls, get this information? So that is why we then bring these parents at a facility and talk to them to make sure that we create a moment where the parents view this provider as a trusted person, and accept that a provider can be used to talk to their girls on matters related to SRH, menarche, and body changes of the girls, and contraception inclusive. So really what we then bring these girls bring the parents at a facility, and we had 41 parents coming at a facility. We went through the curriculum that we want to talk to their girls. We wanted them to actually say, to approve the curriculum and, input in it. And they were very happy. They input in it. They said they added things that they want us to talk to their girls. And we, wanted them to commit that they will refer their girls by just show of hands. A lot of them raised their hands up that, yes, we'll actually refer our girls to the clinic program for the girls. And then at the end of the day, we gave them referral cards that can you go home, give it to your daughter, your neighbor, and all that. And in the next clinic program for girls, we had 70 girls turning up at a facility, and almost 90% of the girls who turned up at the facility were referred by parents. So it was actually a very successful event, because girls were comfortable at the facility because they had the permission from their parents. Provider were as well comfortable to talk to girls because, parents permitted and all that.
Shahada, this is Clarissa. Could I ask a quick clarification question?
Yes, go ahead, Clarissa. Thank you.
This is fascinating, and I'm just curious, when you say parents, was it primarily mothers, or were fathers involved as well, or other caregivers?
Good question. So we did this parent day in 2 different clinics. In one clinic, we had all mothers. In the other clinic, we had a combination of fathers and mothers. So, but a lot of them were still mothers. So we had 7 fathers, and we had like 20 mothers. Mm-hmm. But still we had very few fathers, and moving forward, we think we need to involve fathers as well. Madeline, do you want to say anything?
Yeah, just to add to that, this is Madeline. So we had fathers at one clinic, and we found that actually the number of girls that were referred to that clinic from the parent day was overall higher. So we're really interested to explore that gender dynamic a little bit more. I think we kind of went into it thinking that mothers would be that person, but that realizing through this test that actually the father, as the decision maker in many families, might be that person to target. So something that's on our radar, but that we haven't gotten to yet, I guess, in terms of our next prototypes.
Yeah.
Sure. Okay, thank you.
And so just to follow up, I'm interested to understand, how did you recruit the parents? And do you think that you really changed their mind, or were there parents that were, likely to allow their adolescent girls to have sex, to access contraception?
Okay, so one of the insights that we got out of the team research was that menarche is actually a very good acceptable topic to talk about, and we as well learned that it can be an entry point to SRH. So we used interpersonal communication agents that PSI has to recruit these parents, but then using menarche. So we asked them, when we were inviting them at a facility, we're like, come and learn about your daughter's menarche. Come and learn about issues concerning menarche, body changes about your daughter. So they were excited because their parents, we also learned initially that parents don't talk to their girls. They, can't talk to their girls, ashamed to talk to their girls. So we're like, when we use this and say, come and learn about your daughter's menarche, body changes and all that, it's really attracted them to come and listen. And when they came and we started talking about menarche, now talking even about contraception and all that, they were very excited. They were like, yes, these girls need to learn about these things. We refer them. And one thing that we also that also came out during this parents clinic day was sharing of stories, testimonials. So in one of the events, in one of the clinic, one parent stood up and shared a story, her personal story, where her daughter got pregnant when she was 11 and now she's 19 and she has 4 kids. And she said, I wish I knew all the things. My child could have not been where she is now and all that. And it really struck a lot of parents. They were like, yes, please talk to our kids. Please, we are more than willing to invite them. Please talk to them. Tell them everything. Don't hide anything. And it was very powerful.
Thanks.
Okay. So Girls Clinic Day, this is another concept that we are working on right now, and the components that we're working, the concept itself is actually hosting a clinic day at a certain health facility, and girls will come at this facility either by being invited by their parents or by this interpersonal communication agent that PSI has. And we would invite them to come and learn about their menarche and body changes. Again, use menarche as an entry point to ASRH. So this concept started again as a whole different concept. So it started as womanhood in the box concept. So the concept of womanhood in the box was having a box full of items that will help this girl from girlhood to womanhood. And this box will contain things like pads, information on body changes, information on menarche in general, information on financial independence, information on income generating activities, and other cool stuff like makeup, lipstick, and all that. And so after the imagine that actually came up to that idea, we then sit and look at that concept and say, what was actually the objective of this? And it was actually to drive girls to a facility using that box as an incentive. So we said, yes, it's actually a cool thing, a very good thing. If we use that box, we'll get a lot of girls to go to a facility. They would love that, and they said they like it. But then we said, what is that one thing that we can pull out of the box and use it, and it can drive girls to go to the facility? And we landed on pads as the most viable product. So we said, fine, let's go with pads. Again, with that insight that we had, that usually menarche is something acceptable to talk about. And so we said we can use as well menarche as an entry point. So we had pads as a most viable product and created a narrative around menarche and used that to actually invite girls to come at a clinic at a clinic program. And it was very successful. We had, 66 girls coming at a clinic because of, pads as the most viable product in that narrative that we created. And we then, after that event, we then said, yes, this is very successful, but can we actually take out pads, this most viable product, and see if girls can still come at the facility? So we take out pads, but still we're continuing pitching the same narrative. Again, in the next test that we conducted, we had 72 girls turning up at the facility. Then we said, okay, this is a very successful event again. In all 2 events, girls were coming at the facility, yes, but then no one accessed services. They were coming, they were very active, they were interacting, they were asking questions, they were asking even contraceptive questions, they were eager to know, but no one went to a provider at the end of the session to access services. No one even came back later on to access services. This actually took us back to one of the concepts that was actually created way back, a girl bajaji concept. And we looked at the girl bajaji concept. The concept by itself was actually to create a safe space for girls to talk, to have an SRH conversation. And we know within a bajaji, it's actually a natural environment where a driver is with the passenger. It's natural. They can talk about things. No one will actually suspect. No one will judge. So we're like, that private moment that is in the bajaji, can we apply that private moment in a clinic program? We understand we had already created a safe space for girls who came at a clinic program for them to ask questions and talk. But we then ask ourselves, did we create that, safe space for them to access services? So we then took that component of the bajaji, the safe space in a bajaji, and applied it in a clinic. And it really worked. So we created a one-on-one opt-out private moment between girls and providers, and it was, to all girls who attended the clinic program. So no one judged anyone because they were all supposed to go to that opt-out private moment with a provider. And that way we had 24 girls taking up services because they had that private moment with a provider. They had an opt-out private moment with a provider. So some of them took up services. Some of them ended up setting an appointment with a provider to come back and took up services. So this is an example of how we actually took a component of a component in a different concept and apply it in a different context. So this private moment, this safe space it didn't work that much in a bajaji, but then when we apply it in a different context, it worked very well. So, yeah.
Shahada?
Yes.
This is Clarissa. Quick clarification question. When you say providers, are those all kind of PSI affiliated providers? What kind of clinic setting were you working in?
So these are health facility providers, and we have started working with our franchised facilities providers in private. These are private providers in private health facilities.
Okay.
Yeah.
Thanks.
Okay. So really, as you have seen, we've tested different concepts around providers, parents, and girls. So girls and her influences, the parents and providers. We have a ton of work to go still. We have a lot of learnings to do. Nothing is finished yet. Nothing is concrete. Nothing is perfect as yet. We have a lot of more areas to explore. We want to actually explore the pharmacies. We want to go to public facilities. This is not finished. We have a lot more to still explore, a lot more to still learn. But, these are just concepts that we've actually tested. And as I said earlier, we're excited to really integrate the A360 resources that we have, including the design standards to actually, look at what we've done. So our proposed next steps, we are looking at actually syncing with other countries. We're looking at, excited about finishing our segmentation research and apply that to the work that we've done. Also making sure that we are focusing on the right girls based on the youth needs. But we also, we don't want to stop what we are doing, but we want just to be small about it. As we mentioned, we are testing different, components within concepts, but, we are seeing some of the components are trying to actually tie together. We can integrate some of the components, but as well, we want to integrate the A360 resources into what we are doing. We also want to continue iterating on the design standards. So the core team have actually worked in developing this very good evaluation criteria, and we are looking at actually integrating that and testing that in what we are doing, and helping actually refining and building it more. And we have all tons of annexes here, and I think that will be the end of it. In case you guys have questions, you're welcome.
Thanks, Shahada. Maybe I'll start first, and then I will leave Clarissa ask questions. So it's really interesting, and it's also nice to see how the different ideas and concepts start, fitting together against one framework. So you've started explaining a bit, but I would love to hear your thoughts a bit more on how do you see the Adolescence 360 process being different. And maybe another way of thinking about this question is, what was missing or what were the challenges in what you've been doing that you can address going forward?
Yeah, Shada's kind of saying, does anyone want to? She's been talking a lot.
It's not an easy question, I'm sorry. But not me, because I know you had a lot of conversation last week and the week before with Manya. So it would be great to understand, concretely, what do you see as working differently in the prototyping that would help us understand, that would really be helpful for us to understand?
Okay, I'll give you my biggest thoughts and then everyone else can chime in. So you're saying, how can we basically, what are the learnings we can help others?
And what are you going to do? What do you think you're going to be doing differently with Adolescence 360 that you were not doing?
Yes.
Because of small scale, whatever. The objective was different. How do you see?
Thank you. I love the question. And I think we had so much to tell you guys. We couldn't tell all of it. So the two biggest things for me, and then again, everyone jump in, we kind of laid those out at the beginning. The fact that I think there has been a ton of confusion around those three things we talked about. If we can all align on what the process is versus what tools are that you use in the process, it will clarify so many issues. If that's too abstract, I can go into that later. I think the other thing that we could do is the PSI team has started to develop some design standards, and it's a wonderful idea, and we're really excited about it, and we think it's a great first draft. I think we have found through the process of trying to tell this story back that we could use those design standards. I think we would love to help iterate on those and create and build on them, show how we think they could be helpful to the teams on the ground as they're doing the work, and then as a mechanism for organizing their thoughts before they share what they've done.
Yeah, to build on that, I think one thing that A360 has built in that we will continue to do and that I think is going to be extremely useful for the other teams is really based around this idea of kind of pausing to reflect at key moments. And I think we definitely did it, but maybe not quite as intentionally as it's outlined in the A360 process. So I think one thing that we want to do is make sure that we go back and kind of reflect on what we've done so far, and apply all of these tools that the core team is helping us to build around incorporating the neuroscience lens and the anthropological lens and evaluating some of the things that we've done so far. And then moving forward, being sure to stop at those crucial moments to really reflect on where we are, and then link with other teams, you know, to see maybe in Ethiopia they learned something or they tried something that is really awesome that might be applicable here. And I think that that is going to be really awesome too, to have essentially, you know, triple the size of our team doing research and testing prototypes and all that, that we can continue to learn from.
Great, thanks. That's helpful. Clarissa, do you have any burning question? I have others on my list, but.
Yeah, I do. And I know that there's other folks from the PSI team on the line too who might have questions. So I'm happy to put one out there and then hand it over to others. But I just want to thank all of you, the Tanzania team and for the DC team for organizing this call. I think it's helpful for us just to have more time to better understand what's happened in the process, what's happened since February, where you're at. So thank you for that. One of my questions is around the segmentation and how, and I know this has been a live topic of conversation, but I'm still wondering, so one of the key hypotheses in Adolescence 360 was that we need to be more intentional about who we're designing for, and using the segmentation as a starting point, and not wanting to backtrack by any means in Tanzania, but thinking about how the segmentation can help further refine and target kind of what the solutions are going forward in Tanzania. I would just like to hear more from the Tanzania team about, you know, what the segmentation means to all of you, and how it will kind of, I hope, maximize what's already started and how you're thinking about that.
So I apologize. I've been on holiday, so if I've missed part of conversations around segmentation, I apologize. But I think how I've been thinking about it, and I think how we've been thinking about it, is that we have a deep understanding of girls, and we're coming up with concepts that we're testing. And once we have those segments, I think we'll be able to better target the concepts that we've already started to develop. So right now we're still in a generative process of coming up with lots of ideas and lots of components and concepts. Once we have segments, we can really specifically target those different components at those particular people that we know they will resonate with best.
And so would you see, Madeline, and welcome back from holiday then.
Thanks.
Would you see then kind of going back and collecting additional insights, from those segments to either pressure test the insights you already had, or, and I know kind of the whole line that IDEO.org tends to present, where there's these, various humps and peaks and valleys, and it's meant to be a bit circuitous. So would you see a need potentially to go back and collect further kind of qualitative insights from the segments?
I think there's possibility that we might want to go back and do additional design research. I think though that testing the concepts that we have with those specific audiences will also give us a lot of learning, because as we've we can get a lot of insights and we learn so much during the research, but we continue to learn quite a lot about our audience as we're testing prototypes and giving them things to react to. So I think that also, by actually prototyping those concepts specifically with those segments, we'll learn more about them, and we'll learn what concepts work and what concepts don't. I think the challenge, what we're missing at the moment by not having those segments is that we're maybe talking to 10 girls and we don't, and getting responses from them, but we don't know which segments they're representing. So later in the process, when we're able to, identify when we're talking to a girl, who is she and what are her behavioral barriers and drivers, then we'll be able to extrapolate from that, I think like which concepts we can target at specific places. I hope that makes sense.
Yeah, no, it does. It does. And perhaps it's a bit, we see what you get from the testing the concepts on those segments, and it could be a decision point after that. Do we need insights or not?
Exactly. Yeah. I think we test concepts with them, and if we feel like we're really not, we're not getting anywhere, then we go back and we do further research with them, design research with them, and maybe do some, another generative iterative ideation process around a specific target group.
That makes sense.
This is Rena. Can I jump in on this conversation?
Yes, please, Rena.
Clarissa, just one thing that we've been thinking about with this question, that exact question you're asking, is, how do we learn from the situation that we're in? Because I think that using user-centered design does actually beg a lot of questions about the need for quantitative data. And so having the segmentation we've already know is going to be hugely valuable to us. And I think that having the segmentation data and looking at the ways the segmentation data and then our qualitative data coming out of more of the UCD process, how those align and how they kind of complement one another is going to be really valuable learnings for the project. Yeah. But also actually being able to compare, using segmentation to make decisions about the qualitative versus, using it afterwards. I think it'll be really interesting to have the comparisons. And again, will generate a lot of learning for us. So that's a bigger question around data and research that we're asking ourselves and keeping as part of the framing of this conversation.
Yeah, no, I think that's a great point, Rena, and I completely agree. And it leads me to another question, which is around the evaluation of Adolescence 360, and how do we, at what point do we consider when is the baseline for Tanzania? Given that we'll be building off of these learnings and want to be able to kind of compare to the experiences we're having in Ethiopia and Nigeria. And yeah, I know that's also a live topic of conversation.
And when you say baseline, sorry, do you mean the segmentation?
No, sorry, for the evaluation, for the outcomes evaluation that ITAD's doing.
I think ITAD is best placed to answer that.
Yes, I know.
I don't want to, yeah, but it's a great question. And I think having clarity on that for all of us, particularly as we really start to implement formative research at the end of August, is going to be really important for us to kind of work our timeline out to include that.
Yeah.
So we're noting that, and we'll follow up.
And just jumping on that, so I remember when we had discussed in DC, we said that that the evaluation baseline would be happening before when, the time we move to pilot. So with the segmentation and the work you've been doing, are we still anticipating that we would be moving to pilot phase in January? Is that the timeline we're working with? I know, Rena, you sent us, but just wanted to check in again to see if there had been any changes.
Yeah, exactly. Alice, that is the same timeline that we're working on. We are planning to actually move to pilot from January next year.
And I think, Alice, as with everything, really, it's going to be a bit staggered from country to country. And we're obviously pushing the original timeline back a few months, given where we are now. So I think piloting in the other countries will be a bit later than Tanzania. But we are working really hard to figure out where we can save time and catch up a little bit without jeopardizing the integrity of the work.
I think this is good. I'm glad we're talking about this because I feel like from my brief with Ritu on the last ITAD conversation, it sounded like they were planning to start the baseline in April. So if we're thinking any pilot activities would start before then, we should.
Maybe I'm wrong, Clarissa. Maybe it was scale up. Worth checking.
Yeah.
Yeah, let's definitely clear that up. And again, now that we've got more concrete dates, we're able to project out a bit more accurately when different phases are going to start. And so I think having that clarity with ITAD is going to be really important again, as we start this inspiration phase at the end of next month.
Yeah.
I have a few other questions, but I don't know if someone from PSI who hasn't been familiar with the process has any burning question. I'll take that for a no. So I'm very lucky because I have been able to participate in one of the prototyping session. And so I have questions which are really around understanding, how you've made decision. So I have some really specific examples. So you said, so for instance, so I'll start by the beginning, but I remember during the prototyping process, there were some challenges that we highlighted and we say, oh, we don't have the time, or no, now is not the right time to address this. Mm-hmm. So what's the mechanism to, remember all of that and make sure we are coming back? And then I have a question on, on the Nyakanga and the training of provider. Mm-hmm. Have we decided that we would not be doing Nyakanga, and what was the reason why? And then what other mechanism have you put in place to make, to decide that the prototype that you are presenting to us today are the one that are worth considering? It's a long question, sorry, but really trying to understand, why did we drop some stuff? Why, and why did we follow up on others?
I'm going to answer your second question first. I might partially address your first question in answering that, but
right.
The Nyakanga idea we haven't dropped, but what we did essentially after that immersion is we had a ton of concepts, and so what we did was we kind of laid them all out in front of us, and we prioritized which ones we thought were the most foundational components to make any system work. And so we thought that the focus really had to be on getting the girl to the clinic, finding providers who would offer her services, and influencing her parent, which tends to be her most important influencer. So basically based on bandwidth, we really focused on what we thought were going to be those foundational components of a system, but have not dropped the other ideas. And so we have been working on what we're calling a design plan, which is essentially kind of a map of all of the concepts that we have. And so again, we're trying to build this foundation, and as we think we're getting pieces right, we're either pulling in components from other ideas that we've worked on, but then with the idea to kind of expand out and expand upward, to bring in some of those other concepts that we know are really rich, but are maybe not that, like that most important thing to get right first.
That's really helpful, Madeleine. And I actually kind of answer my first question, because I imagine that in your mapping of possible concepts, you also highlight the thing that you may not have addressed before. Can I just ask Stacey if that's something that you've used in the other program that you've worked on?
Unfortunately, Stacey had to step out.
Oh, sorry.
She's flying home tonight, so she had to leave before we finished to catch her flight.
Okay.
But I will ask her that question and share it with you.
Because that's probably the, if you're thinking about the process, it's the big question is, how do you go back always to the system and ensure somehow that you have, dismiss ideas for the right reason. Mm-hmm. And how do you do that? So that was I was asking, but that's very helpful, Madeleine.
Well, I think honestly that these design standards that the core team has been working on, that we're hoping to pilot here, are going to be that a way to make sure that we're documenting everything and we're evaluating them as we go.
Can I ask, Madeleine, how were adolescent girls involved in the research process? So beyond kind of being, a stakeholder group, were they incorporated anyway in kind of decisions around which concepts we're moving forward? And I know that that's perhaps a new element that we're adding in with Adolescence 360, so that might not have happened, but how are we thinking about that going forward?
Yeah, so we didn't include them as members of our team in our research, in our design research, but that is an element that we're hoping to add in. We've started including adolescent girls a lot more significantly in our testing of ideas and of concepts. And yeah, we were just having, a conversation last week about how we can more intentionally involve them in the actual process and not just be, people that we ask questions of, but actually be decision makers in it. So we have a few ideas around it. I don't think we have anything concrete at the moment, but one idea that we had, for example, was to have an internship program for, young college-age students to learn about PSI's work and also about human-centered design and to participate in this project with us. That would most likely target girls or teens living where we are. So still have to think about how we can involve girls in that process at a distance. And so I think once we have ideas going, it'll be a lot easier because we can send girls out to prototype for us. So there'll obviously have to be a process of training and onboarding and all of that. But I think it would be amazing if we could have girls in other regions prototyping concepts for us and sharing that.
Yeah, and I think there's just a real opportunity for the Tanzania team to help think through what some of those kind of youth engagement models could look like, since you've already done this immersion, and it's something that we're, I think, planning to do in Ethiopia and Nigeria as well. So maybe, that's something that we could talk, further about with the rest of the teams at the end of the month in the boot camp.
Definitely, yeah. And I don't know what the structure is like in other regions, in other countries, but we do have zonal members of our sales and marketing team, zonal communication coordinators. And we're thinking of trying to essentially upskill them in human-centered design as well. And they could potentially be that touch point with girls that are in more field locations.
Great. Well, this has been really helpful. I have another call in 2 minutes just to let everybody know, so I will have to go off the line right on the hour.
Okay. Thank you, Clarissa.
And I'll have to drop off as well, but that's really, incredibly helpful, and really looking forward to hearing how the conversation that you had with Mania on whether this is changing anything in the process. I think it would be also interesting, and maybe to capture I don't know how we do that in the evaluation, Clarissa, but to look at these two different processes and try to distinguish what was really driving creativity between the A360 process and maybe a bit more light touch approach at the beginning. That would be really interesting to see.
Yeah, and perhaps sharing this webinar with the rest of the consortium. I know everyone is eager to learn more. I don't know if that's part of the plan, but
yes,
that'd be great.
definitely is.
Or even have them do the presentation for them, because for sure they will have questions, and it's just really interesting to hear how you've gone about it.
Absolutely. Yeah. We've got it recorded and we have notes, like full notes on it. So there's different ways that we can foster that, whether it's a live webinar and Q&A or some sort of, non-live one.
Great. And I love the Nyakanga idea, I just want to say. Which is not at all,
Actually,
it's
Shahada,
not at all evidence-based, and it's not, it's not aligned with your standard, so don't take me as a,
Alice, we love that idea
Yeah.
too. Actually, me and Madeline were in that group. So
so we both have like a special place in our heart for it and don't want to see it go either.
It's just for something that could be really different. So maybe we'll explore it. I'll let you guys work on the standard and let us know if that's something like that. No, I don't want to interfere in the process.
Sounds good.
okay.
Good. Thanks so
Well,
much,
thanks,
guys.
everyone.
Thank you.
Thank
Bye-bye.
you. Thanks, Shahada, for the
Bye.
presentation.
Hey, thanks so much, Shahada. You can just end the recording, and I think it'll save to your computer.
Okay.